Doctors across the nation are paying more attention to signs of depression in our kids.
Here now to break down how parents can be a part of the process is Dr. Jamie Friedman. Doctor, good morning. Thanks for being here.
Good morning.
Okay, so some of the numbers in this new study released depends on how you look at it. It says 8% of kids 11 to 17 have thought about suicide. We're not talking about just depression here, but it seems to me 8% at that age thinking of suicide is a big number. Your thoughts?
Yeah, it is a big number, and you're right. You do want to differentiate between depression and suicide, but depression is a major risk factor for suicide. And there was a study that just came out that most parents don't recognize the signs of suicide in their kids, and probably don't really recognize the signs of depression either, because when you think about teens, they do go through a lot of flux, a lot of moodiness, so it can be really hard to differentiate what's typical and what's not typical.
I was actually surprised because it says half the parents were unaware, but I saw that as half the parents were aware, because I would think more parents wouldn't have a clue that their kid is considering something like that.
Right. That's a really good thought, and really important that there are plenty of parents that are recognizing concerns in their kids, but it's important to recognize all of it.
One of the biggest concerns, I even sometimes look at my little kiddos, as happy as they are and they're young and they're innocent, but as they grow older and they're teenagers and they deal with so many other different issues, I'm worried about them getting depression. I'm worried about them being bullied. How common is depression in our kids? Because from what I have been hearing, it's happening a lot.
It is happening a lot. 1 in 5 teens will experience depression. And this is just looking at teens. I know talking about your kids are younger, but one of the most important things is keeping those lines of communication open, starting that early, making sure your kids can come to you or a trusted adult if they have any concerns, and really recognizing the signs that you want to be looking for where there might be a concern.
Speaking of concern, because I want to know where we draw the line with this study and moodiness and depression in kids, where do you draw the line between normal teenage behavior and serious concern and you're worrying about your kid? Because, I mean, it's common for teenagers to be moody and the mood swings and the hormones are going all over the place. At what point do you say, uh-oh, this is not normal?
Right. I mean, there are a lot of signs to look for, and I think if there's any concern that a parent has, that they need to go, and have the child checked by the doctor. And we also have screening tools that can help us.
We have some of the symptoms here. So to help parents out, you go through this list, and again, some of this seems like normal behavior. Oh, maybe you have irritable kids and this and that. So can you kind of go through this list and help us out a little bit?
I mean, kids are going to be, irritable sometimes. Teens don't get a lot of sleep. They're going to be cranky, but you want to look for some of the other stuff. Are there change in their sleep patterns? Are there change in their appetite? Are they withdrawing from friends, not doing activities that they normally enjoy?
That's a key, right?
Yeah, oh, definitely, definitely. All of a sudden, maybe they're not doing things with their friends or doing sports or activities. Really just starting to give away things, just changing their normal habits and everyday habits can be a concern, and it might be subtle, but again, if a parent has a concern, definitely address it.
When you say address it, what do you do? I was a teenager not too long ago, and when you go down this list and you talk about these, that's what a teenager, I feel like it is. We go through all of these things. So who do you go to? And you don't want to accuse your child of, feeling something that maybe they're not as well.
Yeah. I mean, you do want to approach it in a very gentle way, but go to the pediatrician. We now have screening tools that really help to let us know, is there a risk or is there not a risk? Yes. Yeah.
I was thinking about how much tougher it would be to recognize this in the younger children, because if you have a teenager, you can almost go off of a baseline. You know your kid up until 13, 14, 15. And if suddenly their grades change, their friends change, and everything changes, then you know you have something to go. How do you do that when they're 8 or 9 years old and there's a concern, because you don't really have a lot to go off of, right?
Right. Well, when they're younger, the symptoms are going to be relatively the same. Do they not play with the same things that they used to? Are they not, in general, do they have a down mood? Are they not enjoying things as much as they used to enjoy? And do you see that change in sleep habits and eating habits and things like that? So it's going to be relatively the same.
Oh boy, bring it up. Talking about things always helps. That's always the thing.
And parents need to be prepared that we will be screening their teens in the pediatric office now.
Dr. Friedman, thank you. Very important conversation. We appreciate it.
7:21 now.